for us to show up. We were caucusing with our colleagues to make sure we were agreed on how the workflow was going. I'm welcoming you to the Committee on Health and Human Services. This is the Monday meeting. We'll be looking at some work session later, some public hearing material tomorrow. But today we're focusing on the budget, hopefully making some progress towards finishing that up. And I know of at least one report that's ready to be delivered. So that's the agenda for today. Budget work and a report. So we're on audio, everything's recorded. Ask the committee when you're not speaking, be on mute. I did remember to turn off my phone earlier today. We can't use the chat box except to move the committee meeting along, and that's only for panelists and not attendees. We will be getting the agenda items from our analysts. And before we do that, why don't we do committee introductions? And I'll start with Representative Griffin.
Good afternoon. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Kenduskeag.
Representative Connor.
Thank you, Mr. Chair. Good afternoon, everyone. My name is John Connor, and I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
And Representative Madigan was with us earlier. Is she? There she is. Okay, thank you.
Hi, I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
And Representative Zager.
Good afternoon, everyone. Sam Zager, representing District 41 in Portland. It was great to see everyone last week in person. I will ask your pardon today. I'm going to have to jump out for a little bit of time, but then I'll be back.
Representative Lemelin.
Good afternoon. I'm Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including the towns of Boothbay, Boothbay Harbor, South Port Edgecombe, West Port Island, and part of South Bristol.
Very good. Senator Baldacci had another. Oh, there you are. Good. Senator Baldacci.
Good afternoon. My name is Joe Baldacci. I represent the city of Bangor in the town of Herman in the state Senate district. Thank you.
Representative Perry.
Good morning. I'm a Representative. Good morning. Good afternoon. I'm Representative Ann Perry from House District 140, which includes Indian Township, Baileyville, Barron, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
Representative Javner.
Good afternoon. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington.
Senator Moore.
Good afternoon. My name is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Good afternoon. I am Representative Michelle Meyer, serving House District 2 in Southern Maine. That is parts of Kittery and South Berwick and all of Elliott.
And I'm Ned Claxton. I'm honored to represent the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, and Poland. We're joined by our crack analyst team. So Anna, if you want to introduce yourself.
Hi, I'm Anna Broom, and I'm one of the legislative analysts, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Erin?
My name is Erin Dulang. I'm also one of the legislative analysts in the Nonpartisan OPLA office.
Luke Lazur is here whenever we talk about budget.
Good afternoon. So I'm Luke Lazur. I'm a legislative analyst in the Office of Fiscal and Program Review.
And Carrie Withy keeps us organized.
Good afternoon. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
Very good. So as I understand it, there is a line item and 5 amendments on the agenda for the day. Does Anna or Aaron or Luke want to take the lead on that?
Sure. So I actually, and I'm looking back now to make sure I didn't miss that, but I think I had 2 line groupings that were still tabled. The first group was lines 347 through 349, which were all in the big map account 0147. And this was the one that reduced funding for savings achieved by establishing a reimbursement methodology that reimburses providers under the federal 340B program at the approximate cost of physician-administered drugs under the program.
Are there any questions on lines 347? Okay. Yes, Senator Moore.
I would make the motion that we not move lines 347, 348, and 349 into the biennial budget.
I second that.
So there's been a move and a second. Is there any further discussion of that? I don't see any, so we can ask Ms. Withy to collect the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Okay. Luke, the
So
next one?
With that, the next one is lines 367 through 369. This was in the MAP account 0147 and the low-cost drugs to Maine's elderly program 0202. And this reduces the main care prescription drug dispensing fee. And this is the one that is currently at $11.89, and this lowers it to $10.59, which is the New England average.
Any questions about this line item? For 367 and 68 and 69. I'll entertain a motion.
Senator
Yeah,
Moore.
Senator Moore.
I would make a motion that we not move those lines into the, so it's 367, 368, and 369, not move them into the budget.
Second.
There's a move and a second. Any questions, further discussion? So we'll ask Ms. Withy to start the roll.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Okay, at this point, I need a little help. What was the line item we were considering when we were talking about postnatal support? Or is that an amendment?
No, that was a bill,
That was a bill.
Okay, all
LD
right.
265.
Okay, so I will bring that up at a later time, and depending upon how our calendar goes, I did want to recognize that on a tabling motion last week, we didn't follow with tradition and approve the tabling motion. So I have offered to bring that bill back up for consideration at the next time we touch base on it. So I just wanted to speak to folks about that. That was a misunderstanding about how to proceed, and we need to respect tradition when we should. So I own some of that, and we'll reconsider that at a later on in our calendar, whenever that turns up. Okay. Any questions about that from anybody? All righty. So now we can go to amendments. So does Anna or Aaron want to jump here on any amendment work you've been doing?
Well, we've drafted them, but I think it might be up to the folks on the committee who have sponsored them to bring them up, but we're happy to help with the language.
Okay.
And we
Very
can
good.
also share our screen at any point too.
Okay, good. Thank you.
So I'm ready.
You're ready, are you, Harley? Why don't you go ahead then?
Sure. The first amendment that I have to discuss with you today is the amendment on the alternative response program. And we have discussed as a committee the concerns that we have about a transition plan, a smooth transition plan, where the alternative response program would end and Families First program that we anticipate being funded on or around October 1st would transition in. But our concern is some of the discussion we've had has been about making sure that that gap doesn't exist between these two services for the safety and well-being of children and families. So the proposal for the alternative response program is to create, to provide funding that would allow for the department as they hire the child protective workers. There's 15 child protective workers in the plan for Families First. As they hire those up, that one of the things that the department has requested is they take over and be the primary respondent for child abuse investigations, and that's an appropriate role for them, and they continue to do that. But that they continue to refer families to the alternative response program. After that investigation takes place by a state worker, that referral goes over back to ARP so that they can continue to work with those families, do the information and the referral, connect with resources and other needed services, and also monitor so that that plan is being followed and that things are being met. And that we would recommend that that gap or that continuation be addressed through this transition until the prevention services addressed in the plan for Families First are ramped up and are ready to go. And that we also have recommended that a severance package of 2 months be available to those workers who will stick it out until the end of the calendar year and not abandon the program. So there'll be actually people there to still do the work while the transition continues, to hire up 15 people, to train 15 caseworker positions. And Anna, I don't know if you want to bring the amendment up on your screen.
Representative Javner, did you have a question?
I apologize, Senator Claxton. I just, I don't want to jump Representative Stowe's explanation of her amendment at all, but I do want to hear from the department what their perspective is on how they are planning to deal with the gap.
Thank you. So Holly, do you want to go over the
Sure.
details of this?
And I'll have to, hold on, I've got to bring it up on my screen because I can't I'm not seeing the whole thing.
There's an option down lower that says follow the pointer. Under view options at the top.
Yes, I
At the
only have
ver-
original size and enter fill screen. That's all I have. I have a Chromebook, so I guess I don't have
Okay.
it. Thank you.
Okay.
Anna, do you just want to walk through the financials because I can't see half of it? If you would. You'll see the first item provides this is one-time funding for the transition. And it requests $500,000 from the general fund. And I can't see below that. So if someone could help me, if Anna could help me there, I think we went too far. And also an additional 500,000. Trying to make the screen work. I apologize.
It's the same 500,000, Representative.
Yeah, it's not.
But it's also, it also includes, anyway, I can't read them, so I'm just going to let it go there. It's $500,000 to provide a transition for Families First till the end of the calendar year. I think that summarizes it well enough.
So it looks to me that underneath on the middle of this page, there's two $500,000 allocations to the same account.
Yes, so it's a total of $1 million.
No, it is just 500,000. That's just the way that our system summarizes things. So the one with the initiative text where it says provides one-time funding, that's the 500,000. Underneath that, you'll see it's just the program summary. That's just summarizing all the appropriations within this program. And it is a little bit confusing when you're looking at it this way when there's not multiple different appropriations. It's just one $500,000 appropriation in 21-22.
One time.
Yes, one
What I
time.
thought it was, but I also was tricked. So are there any additional questions to that before Molly speaks to that?
Yes, Senator Moore. No, we can't hear you. You need to, there we go.
There it goes. It wouldn't let me unmute. So it's being difficult. How did we arrive at the 500,000? That was what my question was.
I don't know if Luke or Anna want to speak to that, but it was actually based on the real cost of the contract, I believe.
We didn't have anything to do with the actual dollar amount. We were told the dollar amount and just put in the 500,000 of general fund. So I don't know exactly where it would have come from.
I think it's the actual cost of extending these programs out until the end of the calendar year and continuing with the transition and providing the severance package.
Yes, Representative Connor.
Thank you, Mr. Chair. Just for my own information and knowledge, ARP workers are independent contractors. Is that correct? Is that a correct statement?
They are the agencies are contracted and they
The agencies are contracted. And so I don't know how comfortable I feel with giving a severance to a contracted agent versus it being our own internal, agency. So is there any way you could speak to that or what the logic behind giving a contracted agency severance versus, our own employees, giving them a severance?
The thought behind that is that in order for continuity of service and enough adequate staffing to make it through the end of the calendar year, there would be an incentive provided to those workers who would stick it out. The greater concern being without the 15 positions up and running and the workers not continuing to do the work, there would be a complete absence of anybody watching and providing services to these families.
Right. So are we giving that severance to the contracted agency and then they are divvying it up amongst their contract workers, how they see fit?
Yes, they're actually agency employees. They're not contracted workers per se. So they would provide that severance package to their employees when they're laid off. And it would be only to those employees that stayed through the calendar year.
That answer your questions, Representative?
Yes, sir. Thank you.
Good. Representative Madigan?
Thank you. I just want to thank Holly for bringing this forward. It's something we've talked about. I want to go on record and say that I think the department moving forward with Families First is something I absolutely agree with. What I disagree with is using the funds taking away from ARP to do that without an adequate transition plan, and I'll explain why. I don't agree that people who work in an ARP program are just going to naturally apply for child protective worker jobs within the department. Those jobs are very different. Folks who work in ARP typically live in their own communities and provide community-based services. They don't get called into court. They don't wind up in a courtroom. They don't have on-call status over the weekend where they might have to show up with police and help with removing children or waiting with children in an emergency room. That is not their job at all. They're people who absolutely believe in providing community-based services in the name of family preservation. So I think that the two jobs are, although similar, are not the same. And one who is interested in doing work in ARP may not be interested at all in working for the department. I'm sure it's no surprise to anyone that I'm in favor of adding more child protective workers. That's been the one thing that you can actually hang your hat on, that evidence supports actually can save children's lives. However, to do that at the expense of getting rid of this program that provides a valuable ongoing service for at-risk families as we're winding down from a pandemic doesn't seem to me to be a good fit. I think that providing more of a transition plan is important. I also think we're missing the larger picture, which is that we're winding down, hopefully, from this pandemic. One thing I've consistently said over the past year is no one, and I mean no one, is having any fun in this. Absolutely no one. And that includes a number of at-risk families. I hear from them in my district all the time, families with really good moms, really good dads that are having difficulty right now. ARP provides a valuable service. We need to be looking at how do we connect people with the vital social services, mental health, and physical health services that can reduce the risk of people suffering greatly as we wind down from this pandemic. And that means more community-based services. And people can disagree with that, but I think we're going to be living with the effects of this pandemic for a long time. And that includes our seniors. That includes folks with behavioral health challenges, substance abuse challenges, and it also includes families with children who are navigating this uncertain time on their own. And I think we need to offer them more than what we've been doing. And I think that means we have to help them in some way. And that does not mean, I want to be really clear about this, I think just saying kind of lift all restrictions or whatever else people want to do is not an adequate plan either. We need to actually be helping people have better health and have better outcomes and help their families be less isolated. So there's my piece.
Thank you, Representative Madigan. Just to be clear with Representative Stover, as I see it, there's three pieces to this. One is the severance package we've talked about. The other is the 500,000 as a one-time that we talked about. And the other is extending the contract through, it says 7/1. I'm assuming you meet 6/30.
Yes,
And it's 6/30/22.
yes.
Yes, okay. Are
So
there
through
any
all the
elements?
15
Go ahead.
To allow that time for those 15 people to be.
Are there any elements I've missed? I just want to make sure we're talking about all the important parts. Okay, Senator Moore, thank you. Senator Moore?
I think that's part of my question, Senator Claassen. Thank you. What is the expiration date of our current contract with ARP? And then is there a clause in the contract for early cancellation? Is there some sort of monies involved with an early cancellation?
So most contracts, and Mr. Mann or Molly can correct me, most contracts run through the end of the fiscal year, which is 6/30. And all contracts have a clause in there. I think it says something like, as long as the funding and program continue, it's sort of a very broad, like if things change tomorrow, it might not have any money anymore, or might not be needed anymore, we would get rid of that. But isn't that correct that most contracts have sort of this broad language about when it could end, and then the other is things run on the calendar year, I mean, the fiscal year of 7/1 to 6/30.
Okay, man, would you care to introduce yourself and then and get Holly answer?
Certainly. Good afternoon, everyone. I'm Benjamin Mann. I'm the Deputy Commissioner of Finance of the Department of Health and Human Services. It's accurate to say that many contracts run on the fiscal year, certainly not all. We have many contracts that they typically all start on the quarters, so either 1/1, 4/1, 7/1, or 10/1. I don't know off the top of my head. I'd say probably half, maybe a little, probably about half the contracts run on the fiscal year, half don't. And these contracts do expire on 12/31/2021. So we're originally proposing to not renew them as scheduled.
Which would be the December 31st, 2021, correct?
That's accurate.
Okay, thank you.
Molly, it seems like you've heard a bunch of questions from the committee. Is this a good time for you to jump in?
Yeah, thank you. My name is Molly Bogart. I'm Director of Government Relations for the department. And I think that's an important point that Senator Moore just brought up. We are not ending these contracts early. This is the time that when these contracts were signed years ago, it was determined that they would end. I also want to speak a little bit to some of the concerns that were raised around the services, and to be clear, of the evidence-based services that ARP is providing as alternative response for cases that are not screened in to have a child welfare caseworker. Those services are continuing. It's the who is providing them that is changing. So there's not an end to the services that children and families are receiving, but rather those will be provided by state workers. And I think as we presented earlier in the budget, we see child welfare response as a key state function. And so I actually feel like moving it into state employees is having some fidelity with the role that we are required to play in keeping kids and families safe. And in relation to the transition plan, I know Director Landry spent, I think, more than an hour last week with you talking about his transition plan with these. And that said, we recognize that there was a concern about a smooth transition. And so I think while we have some pretty serious concerns about the idea of a severance pay when a contract is ending as scheduled with an independent provider, we are willing to talk about how we could smooth that transition. And I think the way that we would envision that looking would be to start the caseworkers a quarter early. So the caseworkers would start 10/1, and then the contract would continue to expire when we've agreed to the contract expiring with the providers on 12/31. And that gives 3 months for the office to hire and train caseworkers and make sure that all of those services remain in place when ARP is transitioned out. And I know there's often when we talk about hiring new staff, there are concerns around whether we'd be able to hire quickly enough. And I do just want to remind the committee that when in the last biennial, you approved, I believe it was 40 or 55 new caseworker positions, within 30 days, we had all but a small handful of those positions hired. And so OCFS has a strong recruitment program and is confident that we can hire these positions in a reasonable amount of time within those 3 months to make sure that we have a smooth transition for the kids and families that we serve.
Okay, are there other questions or comments? So of those, yes, Representative Connor?
Thank you, Mr. Chair. Molly, so just for my own clarification again, irrespective of this particular bill, the department already has a transition plan in place. Is that correct statement?
Well, Sort of. The transition, irrespective of this initiative, the contracts end on 12/31. And our proposal for the next steps to make sure that those services are in place is to hire 15 OCFS staff rather than continue with contracting out the services.
Okay, thank you.
And you said they were going to be, the hiring for them was going to start 10/1?
Our sort of collaborative proposal, I don't want to say counter proposal, our collaborative proposal here is that rather than extend the contracts beyond 12/31, we hire the caseworkers earlier. So the plan in the current initiative is that those caseworkers would start 1/1, I believe, and the contract would end 12/31. And instead, we're saying, let's overlap them a little bit. We'll start the caseworkers in October, and then the contract will continue to end as agreed to with the providers on 12/31. So there's some overlap.
I think I understood that differently, but maybe we need some clarification. My understanding was that the 15 new people in OCFS were going to be hired on as of 10/1, so they could be trained up by the time the resource disappeared on 12/31. That was the original plan. Might it make more sense to move that back to July 1?
Yeah, Ben.
The original plan, we've worked, the contract ends on 12/31, and the funding that's provided that we're asking for in the original amendment has the caseworker starting on 1/1. We would do all the hiring and posting work beforehand, so we could identify the new caseworkers so that they were ready to start on 1/1, and then they could go forward with that. The revision to acknowledge the transition plan would be to back that up to 10/1. So we would do all the hiring before that so they could start on October 1st and be trained up while the contract is still in place for another 3 months.
And how many positions are empty currently of the group of caseworkers in OCFS?
I can find that pretty quickly.
Okay. Representative Perry, you had a question?
Yes, I do have a question. My question is, and I guess this is what I'm trying to understand, the intent is for the caseworkers to take over the work that ARP is doing so that they will be taking and transitioning cases from one caseworker to the next, if I am correct. And now what you're recommending is that that transition begin 3 months ahead of time so that the caseworkers can actually talk to each other and work together so that the family is transitioned as easily as possible. So that suddenly one day you don't have a caseworker and the next day you have a different one. Is that what we're looking at?
That's part of it, and I don't want to speak too out of my knowledge base on ARP, but there's a different the ARP services are voluntary, and so there's a different relationship between an OCFS caseworker and a family and an ARP staff member. And so I don't want to say, yes, every family who is working with an ARP is then going to be assigned a caseworker. It's really a different type of prevention service than what you get if you are involved in an active child welfare case assigned to a caseworker at OCFS. But
those families
I'm sorry?
Covered by an OCFS worker.
I missed the question. I'm sorry.
Happens to the families who won't be passed on to an OCSF worker.
It doesn't mean that they won't be passed on. It just, I don't want to, and this is where I'm going to step out of, I'm going to prevent myself from stepping out of what I know specifically, but it's a prevention services. And so what our caseworkers will be what the new caseworkers will be providing is some of those evidence-based prevention programming that is available under Families First. It is different, but it has the similar goal to when a family is involved with a caseworker. But there's no court order to receive ARP services. And so, ARP, the alternative response is more of an offering of services to families rather than an obligation to families to work with OCFS. And so families will be working with OCFS instead of ARP providers. And I'm probably getting too into the weeds here, but that 3 months will allow for some of that transition to happen.
I guess my question is then, as you get into that, is that in order for a OCFS caseworker, is there a required court order?
Not for these prevention services necessarily, but when someone is involved in a child welfare case, there may well be a court order. In fact, in most cases there is. But these are...
So the Family First expands this at some point so that you don't have to be in court to get the preventive services.
Absolutely, yeah.
That part is voluntary?
I would want Todd or Bobby Johnson to give you more of the details there, but when as the department expands the services that are available under Families First, those are specifically to prevent a family from having a child welfare case or coming into custody. And so they're not, they are voluntary to some extent. That children have to meet the definition for candidacy for foster care, but if they do, then those services are available to them.
My concern is, and I guess this is probably where Holly's come from, I would hate to see a family get lost in the transition.
And I think, we felt that we could make it happen with that same time transition, but certainly recognize the concern of the committee and agree that a smoother transition would be beneficial, I think, to everybody in the equation. And so that's where our proposal to bring caseworkers on a little earlier to smooth out that transition came from.
Can I ask one more question?
Again? Yes.
Okay, if you're doing the hiring earlier than planned, is there a need for more money in the budget to do that?
I do think that there would be, yeah. Let's let Ben talk about money.
Yes, it would recall that it produces savings. There's $421,000 worth of savings that this plan produces, and that would be reduced to, I believe, just over $140,000 worth of savings. So it's about $300,000 or so, a little less, to bring on the caseworkers a quarter early.
Yes, Representative Connor.
Thank you, Mr. Chair. And I don't know who this question would go to, Molly or Mr. Mann, but is there, and if I missed it, I apologize, is there some level of expectation or assumption that a lot of these ARP workers are going to jump ship and become state employees? Are we actively recruiting any of them to come over to be part of the new process and program once the contract ends?
I think, OCFS is not setting the expectation that every single one of these caseworkers positions will be filled by ARP providers, but they're certainly within the pool from which we'd be recruiting.
I would just add that, those state lines are full and open competition. So we would run the typical HR process to post it and then collect applications, do interviews, and then make hires to fill those positions.
Representative Stover.
My question goes back to the I think Representative Perry's question about, and you just answered it, Mr. Mann, about the what would be if we don't anticipate the federal funding for Families First to come until October 1st, how would we fund all of the costs associated with bringing on 15 new people and paying 15 new people earlier if the funding isn't already here? And I think you just answered what you would propose.
Okay, Representative Madigan.
Yes, would the job description of the new 15 workers be any different than current child protective workers?
Honestly, I'd have to get the job description from OCFS.
Yeah, that was my
Sure.
question too about classification.
Right, because that's a very different job description than folks who work in ARP.
Just to tag on to that, the OCFS description now for a caseworker would be more investigatory, and if it's a replacement for ARP, there's more support, family support, and prevention work, as I understand, that goes on. So I was wondering how that will get addressed in those 15 new positions if they're considered to have different duties.
And
They are. I think Dr. Landry's been clear that this is not adding to the number of caseworkers who are actively working on OCFS cases. So this is not going to lighten the caseload for current caseworkers. These are positions that are called caseworkers that are providing other services. So there are different responsibilities within the caseworker staff.
So any other questions? Representative Madigan.
I'm just thinking about what child protection workers do and how that would be different from these 15 workers. Right now, folks who are child protective workers may have investigative cases. They may have ongoing cases with children in foster care. So they're often doing a number of different things. And I guess if these 15 workers are supposed to be different than what the job description of current child protection workers are, I'd be interested in that, because I'm not, and I understand what you're saying, Molly, that you're not saying that, these are just going to be used to lower caseloads, among all child protection workers. But how is it different than that? They're going to have investigative cases, right? Because some of, you guys have been really clear that pulling the investigations back into CPS is going to happen. So they're going to have some investigative cases. So I'm just interested in how it's going to be different, because their workers are often have a number of different hats they have to play and hats they have to wear in their role as a child protection worker. So is this different in any way? Are the ARP workers provide ongoing support for a limited time while they are not under child protective investigation? Is that what's going to happen?
I'd have to check in with Dr. Landry and see if, when he spoke with you all last week, if he spoke to that a little bit. I think it is these caseworkers are going to be offering, extended support and prevention services to these families. Exactly what that looks like, or exactly how we're going to market that, I'm not sure. So I'd have to talk to OCFS.
Okay, Representative Lemelin.
Thank you, Senator. My question is to the 500,000. Could you explain to me what that's paying for exactly?
Representative Stover, do you want to take that? After you're unmuted.
Thank you. The 500,000 would be paying for the alternative response program to extend out an additional 6 months for the transition period. And in there currently is also a severance package piece for 2 months per employee at the end of the contract period. So it really is to continue the program longer than it is currently proposed to continue in order to complete a transition.
So it's 6 months with severance. And who's paying for the 15 new employees?
I have an answer, but I'll leave that to the department because it's not appropriate for me to answer.
The original initiative covers the cost of the state lines to come on board.
But the initial initiative, so there's extra money in the initial initiative for 15 additional workers, but there's not additional money for the 6 months plus severance. Why are we paying a severance?
I think,
I had put the severance into the amendment, Representative Lemlin, because to incentivize those employees who know their jobs are going to come to an end to stay until the end of the contract period to reduce the likelihood that families would be left without any resource in the transition.
Representative Lazar. Yes, follow-up question?
They didn't answer the second part of that question, which is there really no money in the original program to pay for that 6 months with severance, even though there's money to pay for the additional 15 workers, which nobody knew about until right now?
No, I think that was part of our conversations related to this amendment for a while. That's not, that particular part isn't new, but that's why I try to point it out as a different, I didn't point it out as a element of this particular bill. The plan was already to bring them on as of 1/1. And what the department is saying is that we can make that happen as of 10/1 to ease the transition process, is what I heard. But the hire as of 1/1 was already understood from Dr. Landry's presentations.
Okay, I misunderstood that. Thank you, Senator.
Sure. Yes, Representative Molly, did you want to say something at this point?
Just to note that as of last week, there were 12 open caseworker positions that we are hiring for out of a total of 415.
Thank you for that.
2.9% vacancy rate.
Okay, thank you. Luke Lazar, you had a comment?
Yeah, I just wanted to clarify something. I think there's a little bit of confusion around the program end date. And I know Deputy Commissioner Mann spoke to this a little bit, but the program does currently, as of right now, and the way that when the lines were voted in the budget, the program ends 12/31/21. So there is no 6 additional months. It's simply the 2 months of salary. That's the difference in the amendment that Representative Stover is putting forward. I think where Representative Stover might have got a little confused is in the description, it notes that the severance is only for employees who were employed on July 1st, 2021. And if they continue through December 31st, 2021, they receive that severance. So there is an additional 6 months of the program. The program already was planning to end December 31st, 2021. That was the plan that the department put forward in their lines, which, by the way, if you're wondering, I believe it's lines 82 through 84 are the lines that relate to this, where the 15 caseworkers were voted in. So I just wanted to hopefully try and clear that up.
Representative Madigan?
Yes, thank you. A couple things. One, I'm a little concerned as someone who used to run a pretty large mental health school-based mental health program. I'm very much aware of if your contract is ending and the contract is not going to be renewed, what happens is people start looking for a job very quickly. These highly trained professionals will have to support their families, feed their kids, pay their car payment, pay their mortgage, just the same as everyone else. And they're not going to wait till the last day of the contract to start looking for another job. And if they're offered something before then, they're going to jump ship. So that when you know that a contract is ending and that it's not going to be renewed, you're going to have an attrition of staff that happens. And that's my concern about the transition plan. The other thing is that I know we've talked a lot about what the Families First Prevention Services Act as having a plan, and I'm all for that. And some of the things, some of the approved services under the Federal Clearinghouse for that. We've talked about home builders, which is one of the approved services that the federal government approves, which is most like ARP programs, but there's a gap between when that money comes in and when these contracts end, just because you have to take into account staffing and hiring up and training and all that. And I want to make clear that that's the concern I have, because I think I don't disagree necessarily with adding 15 more workers that may do some family preservation work. That's a great idea. I don't think it's a newsflash to anyone that I think we need to have a more robust child protective system. But I think having a transition plan is something that needs to happen, particularly as we wind down from the pandemic.
So yes, Molly.
And I just want to recognize that, there is a transition plan, and that's what has been presented to the committee. And, we, rather than allowing for that potential gap, is why, we've proposed to start the state lines 3 months before the contracts end, in recognition of that concern. So thank you.
Thank you, Molly. I also think it's fair that the presentation about the transition plan was at the 20,000 foot level and not in the weeds. And we have a lot of weeds people on this committee who are really concerned about those kids. So I hope it's understood that this is out of abundance of concern for the kids and not because any of us have a particular agenda about keeping somebody hired or not. And I haven't heard anybody speaking out against the Families First initiative, and the fact that it's going to get us some extra money from the feds is gravy, and evidence-based provision of care. I drank that Kool-Aid. So we're good with that. A number of us are just concerned about the kids, and they're not at the table. So that's the motivation behind some of these questions. Are there any other comments or questions? So at this point, there is an amendment that adds $500,000 to provide a 2-month severance pay and a contract extension to June 30th. Representative Meyer.
Thank you, Senator. I'm wondering if we might, before there is a motion on the table, caucus this.
That's certainly, is that okay with leads? Take some time, step away for 10 minutes, 12 minutes? That will get us back at 2:15.
And my suggestion was that we caucus with the committee Democrats, corner caucus this first.
Yeah. Okay. So we're going to take a break here and talk amongst ourselves. We'll be back at 2:15 or as close to 2:15 as we can. Thank you. Sounds like somebody has a water fountain running.
Maybe it's one of those Zen fountains.
That's what I mean. Yeah. All right. Are we back? 1, 2, 3, 4, 5, 6, 7, 8, 9. And several
We're,
people.
we're missing Representative Stover.
Okay.
And Representative Zager.
Okay. Representative Craven, you have your hand up.
Yes, because I'm fine now, thanks.
Okay.
And Representative Javner did have to leave to go and take her mom to an appointment.
Yeah, I knew she was going to have to do that upside. Okay.
She's going to try to get back online when she gets back. So
We're also
I
missing.
have to do the same relatively soon. So
Yeah. We're also missing Holly Stover. Some of us are getting really good about jumping back and forth between the Zooms. Not a skill I ever wanted to perfect.
Outlook calendar.
No, I must admit, it makes me think of the children's program Zoom.
Oh, yeah.
It's on PBS.
Zoom has quickly become a 4-letter word.
Yes.
So
Holly's, Representative Stover is having a hard time finding the link.
Okay. Are you sent it or am I?
I believe Carrie can send it to her now.
Okay. Yeah, that's why you save the links and you don't put them in your trash can until you're done at the end of the day. I go through and empty out that inbox, a special place to keep my appointments on Sunday. Yes, we did that. We did that. We did that. We did that.
Let's just give her a second to get that email from Carrie and get back in.
All right.
Senator Claxton, Senator Baldacci, if I may, it was great seeing you both this morning.
Oh, it was good seeing you as well.
Good to see you, Representative Connor. He's referencing a SLG presentation.
Be good when we can see each other more often in person. I agree.
Amen.
And it looks like Representative Stover has found her way back. There she is.
They all say hearing, so you have to go through everyone. Thank you.
If you expand the inbox, you can often see the date attached to the hearing. Anyway, do you have a proposal related to your amendment, Representative Stover?
I do. So after thoughtful discussion, we would like to propose that the contracts as planned by OCFS and DHHS continued through 12/31/21, which is what they're currently contracted to do, and that the department move forward with its plan on transition, and if they that they extend that contract beyond 12/31/21 only if by 10/31 or 10/31/21, which is October 31st, they have not hired at least 10 of the 15 workers. If you want me to repeat that, because it's a lot of numbers, that we continue the contract through the end of the fiscal year as it was planned, and that by October 31st, if 10 of the 15 have not been hired, we request the department do 3-month amendments to continue ARP until they're fully staffed with 15 caseworkers to replace the ARP. So essentially, the only change would be if 10 of the 15 weren't hired by the end of October, that an extension go to the 12/31 for 3 months to allow the department the extra time to hire the other 5 positions.
And you said amendments, but I think you meant extension, 3-month extension.
Thank you.
You've
3-month
got amendments. You got amendments on our mind. Yes, Representative Meyer.
Thank you. We also talked about the severance aspect of Representative Stover's initial amendment.
And removing the severance.
So as it stands now, the amendment includes an allocation of a one-time $500,000 and a contract extension for 3 months if 10 of the 15 aren't hired by 10/31/21. Is that a fair summary? Okay.
Yes.
So I'll entertain, are there any conversation about that? All right, then I'll entertain a motion. Yes, Representative Anna.
I'm sorry, I just need a clarification. Did you say you are keeping the severance or not? I heard it
No.
both ways.
We will
So
eliminate
that's what I thought. Okay, and while I'm here, I just want to make sure to keep on your radar that when Molly talked about starting the caseworkers early, we'd also need to include that as part of your amendment because it's not currently in the proposal.
I'm sure Representative Stover will be willing to add that to her amendment.
Absolutely. Since that was the part of the proposal the department brought forward today. Yes.
Thank you for that, Anna. Any other comments or questions before we entertain a motion? I'll entertain a motion. Representative Stover,
So moved.
do you have enough to go proceed, Anna?
Second.
And then moved and seconded. Any discussion? So that takes us to Ms. Withy for the vote.
Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover. I'm sorry, Representative, I
I
couldn't
said
hear.
yes.
Oh, thank you. Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 8 yes, 3 no, 2 absent.
Thank you. The next is to go to Representative Stover's amendment, second amendment. Amendment number 2. And I'm going to step away for a minute and ask Representative Meyer to take over the chair.
Thank you. Go ahead, Representative.
This amendment, some of you may remember, was part of in the 129th legislature. There was a bill put forth by Senator Herbig and Representative Foley to provide $2 million to domestic violence and sexual assault in recognition of the amount of services that they currently provide and the fact that they had not had any increase in many years, substantial increases in many years. And it went forward and it had tremendous support and it passed. However, it was a one-time $2 million and it's coming to an end. And so this amendment is to continue that funding because the services that were provided, the hiring was done and the positions are sustained and the programs are going forward. And during COVID, we know that domestic violence and sexual assault, we are concerned that they are on the rise and that isolation and the inability to use shelter and the inability to leave have been exacerbated by COVID, unemployment, and other factors. So this amendment is to request, it is a $2 million request out of the general fund to continue to support domestic violence and sexual assault services. And I would entertain any questions.
Questions? Yes, Senator Moore.
Yes, thank you, Representative Meyer. So Representative Stover, do we know how much of that one-time $2 million is still left in the fund that has not been used yet?
I do not know. That would be a good department question.
And then I guess piggybacking that question would be, do we have an accounting of how it was spent, how the monies were spent of that 2 million?
And can we clarify, my recall of the amount of money is different. Was it 2.5 million? Yeah, it was 2.5 million annually.
2.5, okay.
Yeah, for a total of 5 million.
Okay. It was 2.5 and included funding for all of the agencies. And the other thing is, when we passed it the last time, it had money in the Fund for Healthy Maine, and we're not recommending that any money come out of the Fund for Healthy Maine for this going forward.
So the question from Senator Moore is a balance. Is there a balance? And also, is there an accounting of how those funds were spent?
Correct.
And I see Mr. Mann's popped in. Good afternoon.
Good afternoon. I don't have for you today right now the accounting of, I imagine the majority, if not all, was encumbered, but I would have to double check with our team back at the department.
Senator Moore, another question?
Well, not another question, Representative Meyer. I guess at this point, I would propose that we table this amendment until we get more data so that we can really make a good decision on moving forward with this program. I think that would be very important.
Second.
We have a tabling motion and a second. Ms. Withy?
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Senator, are you back with us in the chair's position?
Not yet.
Okay.
I'm here for the tabling motion. I just wanted to get my second in there.
Okay. So moving on.
Representative Meyer, just real quick, do we remember what the LD number was, Representative Stover, from last time?
It was in the budget.
Oh, was it in the budget? Okay.
Can I had to step away from my desk. Can I register my vote?
Yes. Go ahead, Carrie.
I think because it was just a tabling motion, you don't have to.
Okay, I mean, what was it passed?
Yes. Yes.
Okay.
Yeah.
Then you can put me down as a yes.
Okay.
Thank you.
Thank you.
Thank you, Senator. So we do have, I think, at least 3 additional amendments. Representative Craven.
Thank you, Madam Chair. Mine was pretty simple, really. It is on line 447 of the budget, and it was to extend the 5 limited period environmental specialist 3 positions from June 17th, 2023 to 2027. And that is to encourage people who are employed in the positions to feel more confident about their positions and to hang in there for a longer period of time. And I understand from Luke that that is permissible. And I don't want to speak for Luke, but I just wanted people to know that he said that was okay.
Luke, did you want to comment?
Sure. So I did look into the idea of extending beyond the current biennium, and I was pretty positive it was possible. I just hadn't seen it myself, but I went back to the last budget, and just in the last budget, there were 2 different positions or groups of positions that were extended beyond that biennium. So it's definitely permissible. So that's a pretty easy change we can make. If that is something you want to propose, I do think since the line was already voted, it would have to be re-voted to amend it. So I just wanted to put that out there as well.
And just refresh my memory, what line was that, Representative Craven?
It was line 447 of the budget.
447. So questions about Representative Craven's amendment? Concerns, comments? Yes, Representative Connor.
Thank you, Madam Chair. I was just curious, if we're pushing it out so far, why are we not trying to make these permanent positions versus temporary positions?
I think that Mr. Mann probably would answer that.
Deputy Commissioner Mann.
We propose them as a continuation of limited period positions. I think the intent behind extending it is to provide some more certainty around that through an extra 4 years of the time period for that limited period position. It's your prerogative if you want to make it permanent. I think there is a sense at some point there will be less work on this front as we work through lead inspections, which is why they were proposed as limited period in the first place. It happened before my tenure, but that's my understanding.
And if I'm not mistaken, a lot of these positions are not currently filled right now, correct?
As of, we had this very brief discussion. I looked into this a couple of weeks ago when we had a conversation around it. I believe, I recall 5 of the 8 are filled, and the balance of the 3 are being actively recruited for.
Thank you, Madam Chair. That's all I have.
Thank you, Representative. Additional questions. So in order to work this amendment or to move this amendment, we would need to, go ahead, Representative Perry.
Yeah, the question I do have, these are temporary positions, even if they go a bit further. What happens if the need of that position ends earlier?
Deputy Commissioner?
If the need ends earlier, presumably it would be like any other position. And if the folks roll off, it would be a vacant position. If not, I mean, I would have to consult with the environmental team over at CDC on work that they would do. I think there is a sense that this work will continue for some time, though.
Yeah, this is Margaret Craven, and I say, living in Lewiston, it would be a miracle if this position would end with the level of housing stock that we have here that is lead contaminated, and it's a worry, you know, that we keep the inspectors, and that's why I had asked for the extension. Thanks.
Thank you. So we've already voted this line 447 into the budget. So in order to amend it, I'm not exactly sure how we back that out.
I move, Madam Chair, that we open up line 447 of the budget to reconsider the end date for the limited period positions.
Thank you, Representative Craven. We have a motion to reconsider line 447. Do we have a second?
Second.
Any discussion? Go ahead, Carrie.
Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yeah.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 6 yes, 4 no, 3 absent.
So we have an amendment from Representative Craven that extends those positions to 2027. Do I have a motion?
So moved.
Second.
Any discussion? Go ahead, Karen.
Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 6 yes, 4 no, 3 absent.
Senator Claxton, do you want to take over? We can,
So at
I
this
can
point,
present my,
we worked our way through the amendments.
well, actually, I've got an amendment.
Yeah,
So I'll hand over the chair to you and introduce mine.
if you would.
Okay, thank you very much. So my amendment increases the Fund for Healthy Maine allocation by $5 million annually in the Maine CDC program to maintain tobacco prevention and cessation interventions. For some context, the biennial budget proposal includes a reduction in funding of $5 million per year in each year of the biennium for the state tobacco control program when compared to the funding level of the current fiscal year. Current FY21 funding totals 13.9 million. 5 million of that is not carried forward into the biennial budget we are currently working, resulting in a 36% cut in core program funding. That 5 million was technically one-time funding, but as we all know, the need is hardly one time. I will ask Anna and Luke to weigh in on how we propose to make this happen.
So I guess for that, I will share my screen just so I can show the actual document. I think it makes it a little easier. So the important parts here, as Representative Meyer noted, this gives 5 million.
We're not seeing that, Luke, or at least I'm not. I'm just seeing a
I'll
strip
try it
down.
again.
Okay.
Worked the first time and then you fix something.
Yep.
All right, is it up there now?
That works.
Okay, great. So the first part is that this provides the ongoing allocations in the tobacco prevention cessation within the Maine Center for Disease Control and Prevention. So that will be that's a $5 million annual allocation. There's to go along with that, so as to not have an impact on the overall Fund for Healthy Maine funding, there is a deallocation in the medical care payments to providers account, so which decreases the allocation within the medical services, and that also is an annual ongoing allocation. So that means that the impact to the Fund for Healthy Maine of those two is nothing. There's a zero impact to Fund for Healthy Maine itself. But then to go along with that, there is an increase in general fund funding for medical services. The reason that's done in this case is the Fund for Healthy Maine money that goes to medical care services is used to pay for the medical services that currently happen. Just because the funding's taken away, those medical services are still going to be there. So this provides the general fund appropriation that's also an ongoing annual appropriation so that those services are still funded. And that 5 million, sorry, I'm moving a lot here. That 5 million annual to the general fund is proposed in this to be handled at least for this biennium by lapsing an additional $10 million in the medical care payments to provider account, which would offset the general fund cost of the appropriation in the 2 years of this biennium.
Are there any questions of Luke's presentation or Representative Meyer's amendment at this point?
Mr. Chairman, I would.
Gary?
Oh, I'm sorry.
Yeah, Luke, I hate to say this, but I missed something there. Would you go back to helping me understand what you meant by the $10 million piece of it and what that means to the rest and how it fits into the total budget?
So the intent there is that if we did this amendment without those lapsing funds, there would be an additional 10 million of spending in the general fund account. So by lapsing funds from previous years, what those funds do is they go into the unappropriated surplus of the general fund. So that means that 10 million of lapsed dollars covers the additional new 10 million of general fund spending that this amendment proposes for this biennium. So initially, what that's really doing is offsetting the general fund costs, so that net, what this does is it creates a change in Fund for Healthy Maine that has a net zero impact to the Fund for Healthy Maine overall dollars. And it increases general fund spending, but covers it in this biennium to have a zero general fund impact in the biennium. So that the goal there was to make the change without having an overall impact on either of the funds.
Thank you. Now, and I'm going to ask this question because we're asking for this to be more permanent, is that we're taking this out of what we have been talking about, is getting Medicaid payments out of the Fund for Healthy Maine, because this is a preventive fund to work with the tobacco issue as well as other prevention work that the Medicaid, we feel the Medicaid funds, or I feel, does not cover that kind of prevention. So essentially you're saying that right now, this is going to be covered by funds that have not been expended out of the Medicaid account that can be put into that. Am I correct?
So yes, because it's using funds from previous years that were unspent in the medical care payments to provider account to fund this for the biennium. And again, I just want to be clear that I keep saying for the biennium, because obviously those lapsed funds only cover this biennium. After that, the ongoing appropriation is still there, but that'll be part of the next budget discussion.
Thank you.
That answer your questions, Representative Perry? Okay, any other questions? I don't see any. So I would entertain a motion related to this. Yes, Representative Perry.
I would like to move the amendment in.
I'll second that.
There's a second. Thank you. Any discussion of this amendment and moving it into the budget? I don't see any, so that gets us to Ms. Withy to do the vote.
Yeah, just hold on. Yeah.
So I'm a
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay, yes, Representative Connor.
Thank you, Mr. Chair. If I may, I would like to change my vote on the reconsideration. Still learning all of this, customs and courtesies, so I apologize. I would like to change my vote on Representative Craven's reconsideration to a yes vote.
I move to open up the vote to allow Representative Connor to vote on his amendment on the bill, on sorry, on the amendment.
Second.
Senator Moore?
Yes, thank you very much, Senator Claxton and Representative Meyer. I think as our caucus, we would like for the entire caucus to be able to maybe have a revote or a reconsideration on that reconsideration request. I think there was a bit of misunderstanding and a courtesy to allow for that. So we all kind of voted on, we're all learning too. And as John said, that Robert's rules is Representative Connor has in hand is very helpful.
So
I don't know if it can be done.
who voted in the majority on that resolution?
We did.
Okay,
And
so I would need a motion from somebody in the majority to move to reconsideration.
So I move that we open on the vote for reconsideration.
Second.
And there's a second for that. All those in favor, heads up, Ms. Withy, of voting to reopen for reconsideration, that particular motion, we'll get the votes from Ms. Withy.
Okay.
And we'll do this formally.
Okay.
Sorry.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Okay.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Hold on.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay, so we have moved into reconsideration. So I would request a restatement of the motion.
Yes, Mr. Chair. I would move that we, on line 447 of the budget, that we extend the end date for the 5 limited period environmental specialists, 3 positions, to be extended to 2027.
From 2023 as it's currently written in the budget
Yes.
that we moved into the budget. Is there a second for that motion?
Second.
It's moved and seconded. Is there any further discussion of this now that we're into reconsideration? I don't see any. So that means again, Ms. Withy, that you can run through the votes.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
May I ask a quick question, Mr. Chair?
Sure.
I misunderstood.
Point of order.
Point of order, Mr. Chair.
Thank you.
We are voting in the line item now. Is that correct? Our reconsideration vote just happened. So this is the actual vote to move the line item in. Is that a
Yes.
correct statement?
This is to move the change from 2023 to 2027.
That's what I
Does that
thought.
answer
So
your
my,
question?
it does. And so I am a no.
Okay.
Senator, I misunderstood that also, so I need to change my vote.
I'm sorry if that wasn't clearly stated. We should reflect that Representative Lemlin is voting no. Can you do that, Anna?
Yes.
Okay. Representative Griffin, you have your hand up too.
I do, because I thought we were voting to reconsider the reconsideration, so I was just confused. So I wanted to vote no, not to put the line in also.
Okay.
So I'm so sorry. It was
No,
just
no.
confusing.
No, we're all learning here and okay. Thank you for clarifying that. So we are currently voting on the reconsidered motion, not reconsidering, the reconsidered motion. So Ms. Withy, can you pick up again?
I'm sorry, was Representative Griffin the last person I called? I can start at the beginning.
Why don't you start at the
too.
front end? We'll do it right
Okay.
through. This is a vote on a motion to change line 447 from 2023 to 2027 for the hiring of that individual.
Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 6 yes, 4 no, 3 absent.
So Representative Connor, I have a 2-pager that is a cheat sheet for Robert's rules for motions, which I will be glad to make available to the committee so that we can all be on the same page, so to speak.
Thank you, Mr. Chair. I've got about 3 or 4 books over here, so a Cliff's Notes version would be much better.
This wasn't for Cliff Notes. This was for physicians who became legislators. So, all right. Next item. Anna, do you have anything else on the agenda that we need to tend to?
Yes, I'm just pulling it up though. Luke, do we need to talk about the updated GA funding part, or are we all good with that? You know how we had to update the fiscal note piece?
Yes. You're asking Luke.
Did we show you? I don't know if we showed you already. That's what I'm trying to.
I'm sorry.
We were made aware of it before we voted.
Okay. All right. So what I did want to make you aware of is I'll send this to you, but I want to show it to you. It's related to the mortality review panel. So I just wanted to show you, first of all, the language, if I even manage to figure out what I'm doing here. Where is Word language? So this is the language part. I just want, you've seen this before, but I just wanted you to be able to see that it is drafted now and it's ready to go, and that this subsection 1 is the one piece that you changed to reflect what the department was looking for, to include all of the waivers and the state plan amendment in this, the definition of adults receiving services. So that was the first thing. But what I really wanted to show you was, well, actually, I'll just talk for a second first. So I did talk to Maureen about the issue of who does the public records exception review, because there is a public records exception in this language. There's some confidentiality which requires a review by the Judiciary Committee. So I did talk to Maureen about it because technically this is the Appropriations Committee's bill. So it would be their job sort of normally to do that public records exception review. And so we wanted to see, we don't want to step on any toes. So Maureen checked with her chairs and they are happy for this committee to do the public records exception because you did it before. And so I have, now I can't find the share screen. So I have drafted this long letter, which I will send to you. I don't expect you to read it now, but I just want you to be able to see it, to the Judiciary Committee. And we did include this language in here that said that we have communicated with AFA and been assured that in the interest of expediency, it makes the most sense for us to request the judiciary review. So when we hear when the Judiciary Committee wants to do that, that will require the digital virtual presence of presumably the chairs of this committee to make that pitch to the Judiciary Committee for why those records should be confidential. So we'll be in touch with you about that whenever that happens, and we'll do our best to prepare you for that as well. But they do like it to come from legislators, not from staff. But we have written the letter and gotten it ready to go. It was very easy to do because we did it 2 years ago for 1377. So it was just a matter of updating the background part. But I wanted to let you know that it happened, and I'll send everybody that, and you have it ready. But I did want to let you know it was coming so that it wouldn't come out of the blue for you.
Okay. Anything else?
Not budget related, but I do understand that Representative Connor plans to do 2 book reports for you.
And we also have Representative Zager, who's offered to do a book report, and he's back with us. So that's good. Thank you all for stepping up. Representative Connor, if you'd like to go ahead with your book reports.
Excellent. Thank you, Mr. Chair. Is it possible to find out if anybody is listening in by phone first? Just so I know.
Well, it doesn't matter because it's being broadcast in audio too. That's what you're worried about, something.
I'll make sure. Is there a phone ringing? I hear a phone. So my report, the first report that I have is on the Maine Child Welfare Advocacy Panel. And so I have a quick little slideshow that will help get through this very quickly. So first of all, why do we have it? It's in statute, Title 22. There is the quick reference to the statute of Child Welfare Advisory Panel and their annual report and why it's required to provide it to us. It's also worth mentioning that it is part of federal law, U.S. Code 42, Chapter 67, Subchapter 5106A. It is federally mandated that groups of professional and private citizens who are responsible for determining whether state and local agencies are effectively discharging child protective and child welfare responsibilities. So it is federally mandated. So who is the panel? The panel are a group of volunteers who are broadly representative of the community, including those who have expertise in the prevention and treatment of child abuse and neglect, and those who have personal experience with the child welfare system. You can see here from the little pie chart, the bulk of it is made up of youth and parent advocacy, as well as the Department of Health and Human Services and Legal Services and Administration. The Department of Health and Human Services, OCFS, the Associate Director of Child Welfare, serves as the liaison to the panel and co-chairs the panel with a citizen member. OCFS staff serve as non-voting and coordinating members of the panel, so worth mentioning. What they do, as you can see there from the 5 bullet points, they basically act as a quasi oversight of the agency, of the department. They help provide public outreach and comment to assess the impact of current procedures and practices. They review and evaluate state investigative, administrative, and both civil and criminal judicial handling. They make policy and training recommendations, and they prepare an annual report, which we are going over now. Where are they? Some of the main child welfare advisory panel membership organizations, you can see where they're located there and some of their names. Obviously, they tend to congregate a little south, I think as far north as Bangor's is what we have there. So just a quick snapshot of that. All right, and then let me catch up here. So back in, well, a primary focus of 2020 for the panel was to figure out the role and function of our citizens panel as a separate entity from the Department of Health and Human Services that is informed by the Office of Child and Family Services and driven by the voices of key stakeholders. On January 31st of 2020, the panel released a final report of a parent survey, which was administered as part of a 3-year system assessment process. So between March and June of 2019, a total of 65 parents responded from 13 different counties in Maine. Of the total respondents, 21 were currently involved with CPS, 16 were involved within the last year, and 16 were involved 1 to 3 years ago, and 12 were involved over 3 years ago. So what the panel did was they used the survey answers and responses that they got back, and they voted to use them in the following ways that you can see here. They wanted to share the results with parents, caregivers, and OCF staff. Examine the current policies and practices, gather more information on how they conduct quality assurance to better understand how parents and other caregivers are involved, and then determine the best schedule to continue administer the parent survey moving forward. Some of the focus areas that they looked at were the Family Prevention Services Act and how they're going to move forward. The panel members participated in multiple stakeholder groups to provide input to OCFS and in creating the Maine Family First plan. So Maine intends to submit the state plan for federal approval in early 2021 from implementation in October of 2021. As far as the father focus practices, in their 2020 to 2024 Child and Family Services Plan, OCFS committed to focus on outreach to fathers and the paternal side of the child's family as part of the larger family engagement goal. Working alongside OCFS staff, the panel also began examining Maine's fathers-focused child welfare practices and developed formal recommendations outlined later in the report. As far as the citizen review panel development, the panel held its second annual retreat in September and hosted keynote speaker Blake Jones, Dr. PhD from University of Kentucky and National Citizen Review panels. The retreat included time for subcommittees to meet and develop strategic goals for the year. Looking ahead, the panel, they want to look into family-centered policy and practice work groups, identify strategies of supporting family engagement and make recommendations where it can be strengthened. For effective communications and coordination group, they want to identify strategies that can increase access to pertinent health and educational information for children and youth in care. For the child welfare staff training groups, they want to review the existing training provided to new and experienced child welfare caseworkers and supervisors and identify gaps in the workforce education. Among several areas that studied by the panel during 2020, 2 resulted in recommendations voted on and approved by the full panel. One was father engagement and the second was workforce development. So under father engagement, the panel recommends that OCFS engage in a concerted and sustained effort to improve the department's ability to effectively engage the fathers of children involved with OCFS. They're trying to meet fathers where they are. So the panel recommends that OCFS partner with the panel to facilitate statewide listening sessions with current and former fathers of children involved with OCFS. They should focus on determining why father engagement is not happening at a higher rates in Maine. Use that feedback from the listening sessions to provide supports for fathers that meet the needs of parents. And then they want to make engaging fathers a core value in the training for all of their new caseworkers. External stakeholders should have father engagement values built into all child welfare contracted service expectations, such as family visitations. And then they want to invest resources. So OCFS should build capacity to fully address statewide father engagement practice improvement by investing time, money, and personnel. The panel recommends that OCFS seek funding to create a position under the Associate Director of Child Welfare Services, specifically for father engagement. And that's what I just kind of read for you all. And then the second part of it was the workforce development. As you can see there, OCFS, through a cooperative agreement with the Muskie School of Public Service, Cutler Institute for Health, they want to have a comprehensive review of child welfare policies, training, and child welfare staff and resource for parents. And then they also want to have an allocation of new child welfare staff positions, implementation of the structured decision-making tools, and the procurement of clinical support services. And then finally, OCFS also continues to partner with the Attorney General's Office and the Maine Judicial Branch to improve the experience of families in the court process. And then I think I missed a slide, but that's pretty much it. They, in a nutshell. Any questions?
So before we get any further, did everybody appreciate that if you go to the view button at the top of the page and click on speaker, you got to see those slides blown up and you got to see Representative Connor in the corner. So that was pretty slick. Will you be available after committee to, now that you've raised the bar, further instruct? Do you have any questions for Representative Connor? I don't see any. Did you have a second one you want to do now?
Sure. If you could give me 1 second, I'll change over here real quick.
Sure.
Okay, so the second report that I had was for the Maine Developmental Disabilities Council. And again, this one comes right out of statute, why they are required to provide us this annual report. Who are they? Before I get into who are they were also created through the Developmental Disabilities Assistance and Bill of Rights Act of 1970. So again, this is also federally mandated. This council is a partnership of people with disabilities, their families and agencies, which identifies barriers to community inclusion, self-determination, and independence, and acts to effect positive change. They act to affect positive change through advocacy, capacity building, training, demonstration projects, and support for other inclusive and collaborative systems change activities. Their mission and purpose is to create a Maine in which all people are valued and respected, because we all believe communities are stronger when everyone is included. They promote systems change. They want to help people live and fully participate in society, promote independence, integration, and inclusion. Their membership is made up of 27 members, and I'm not going to read them all. You can see there. The highlight is that, the bulk of the committee members are either individuals with developmental disabilities or their family members. And then 6 can be either or. So that is the bulk of the committee. And then of the 6 designated for each department, the departments are, there's 1 member from the Office of Aging, Disability Services, Office of Child and Family Services, Children with Special Health Needs. Those are all from HHS. And then from the Department of Education, there's 1 for Special Services, Child Development Services, and Vocational Rehabilitation. So that's the makeup on the membership of the committee, the council. What do they do? We briefly touched on it already. They engage in advocacy, capacity building, and systems change activities that address all of these things: employment, health, childcare, recreation, housing, transportation, community supports, quality assurance, self-determination, education, and early intervention. Again, to continue on what they do, they promote and provide small grants and activities, expand the capacity of communities to provide help for IDD community. They advocate for systems change that allow individuals with developmental disabilities to achieve full integration, increase public awareness, and work to eliminate barriers. They foster and support coalitions and other advocacy and community groups, support close working relationships among various public and private service providers. Who they help here in Maine? There's approximately 217,000 Mainers that report having a disability. Approximately 21,000 Mainers of all ages have developmental disabilities. Some of the concerns that the council has is access to adult developmental access to the services and supports. Upon reaching adulthood, the availability of individual and family supports change from a model of entitlement to eligibility. Substantial functional limitations, they have to demonstrate that they have substantial functional limitations in 3 or more of the areas of major life activities, such as self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. Another one of the items of concern is the children's service and special education. Children with developmental disabilities are entitled to a fairly robust array of services and supports. However, Maine families experience very significant challenges in assessing those services, especially the areas of early intervention. Quite frankly, they're not receiving timely and effective services due to the de facto wait lists, the high rates of staff turnover, insufficient funding, and erosion of service delivery capacity due to systemic regulatory changes. Also obtaining community supports. Just going to quote here, there was one father who spoke to the council of having to decide whether an unreliable support person was preferable to no support person at all, and of changing holiday plans based upon the availability of support. So getting the community support is a definite concern of theirs. Some of the other service concerns that they have is the Office of Aging and Disability Service provides developmental services to approximately 6,000 individuals. There are thousands more Mainers who meet the federal criteria of having developmental disabilities. Some receive appropriate services through another sections of Maine Care, such as 1920 or 50. And some of their other concerns there, they talk briefly about, poverty. 32.4% of working age Mainers with disabilities live at or below the federal poverty level, compared to 7.7% of people without disabilities. The unemployment rate among developmentally disabled individuals is around 30%. So that's definitely a concern of theirs. Another big concern is the aging of caregivers. In Maine, it's estimated that approximately 4,200 persons with developmental disabilities are living at home with caregivers over the age of 60. And then they spoke briefly about a lack of dental care for those with developmental disabilities. And then they harped really long on the transportation piece. They really they see transportation as the biggest concern for those in the IDD community. Some of their projects and initiatives, their 2020 highlights. These I won't list them all or read them all, but you can read there. Those are the things that they wanted to highlight and touch on. Their biggest one being advocacy. Their inclusion awards. There was a program where they have, I believe it was an art. Let me pull it up here. Yeah, essay and artwork contest that asks Maine students to reflect on the value of inclusion for people with developmental disabilities in the schools and communities. I thought that was a really cool program that they did there. So these are just some of the initiatives and highlights that they wanted us to, be aware of for 2020. They have a 5-year plan. You can see there their goal number 1 for the council will engage in advocacy, capacity building, and systems change activities that support individuals with developmental disabilities, their families, and the communities to have increased choices. They have a few objectives for goal 1. Obviously, they want to collaborate with the DD network partners to increase the civic engagement. They want to support a diverse Maine communities to increase capacity to be fully inclusive, support in statewide self-advocacy organizations, and then they want to partner with individuals with developmental disabilities. And then the goal 2, they want to engage again in advocacy, building systems change activities. And they want to use these objectives, improve the integration of services and supports. And they want to support efforts to improve quality of services, support the efforts to expand access, and then increase access to information services for the underserved persons. And that was their report. Any questions on that one?
I don't see anything. That's a nice presentation. Thank you. So Representative Zager's here, and I understood that he wanted to do his presentation today.
Sure. Thank you, Mr. Chair. And I will also put in a request that I could definitely benefit from that summary of the Roberts rules. I was confused as well.
I have sent the link to Ms. Withy, and she'll be forwarding it to everybody on the committee.
Thank you, sir. I appreciate it. I am reporting on it's a report back from the Office of Main Care and Director Probert regarding a resolve from 2019. This is regarding housing-related support services within Main Care. It was originally sponsored by Representative Drew Gattine and co-sponsored by Representative Craven, among many others. So the LD 1318 called for it was resolved to increase access to housing-related support services, instructing the department to do two things. One, examine opportunities to provide housing-related services to persons experiencing chronic homelessness who have mental health or substance use disorders and other vulnerable populations. And two, collaborate with Maine State Housing Authority to solicit input from stakeholders. So it's an information gathering thing to figure out how we could break the cycle. There was a discussion report on risk factors for long-term homelessness. These include many things that we're familiar with: complex medical conditions, mental health conditions, substance use disorder, intellectual and developmental disabilities. Pardon me. I guess that'll go on my penalty for the
your $5.
$5. Cognitive impairments from brain injury, learning disabilities, or history of placement in psychiatric hospitals, EDs, rehabilitative clinics, treatment centers for substance use disorders, and child welfare placements. Those are all risk factors for long-term homelessness. On the other side of it, the sequela, or the downstream things from long-term chronic homelessness, include things such as poor health outcomes and higher costs as people, for instance, don't have the benefit of tobacco cessation programs or primary care, et cetera, and end up showing up in the emergency room, unfortunately. The irony or the tragedy that often occurs is that there may be a housing voucher available, but because a person is chronically homeless, they're unable to organize things, the person remains at risk of continued homelessness and all those other sequela, bad health outcomes, higher costs, et cetera. So the work group that stemmed from this resolve is developing a proposal. I should mention the timing here. Just as Senator Claxton mentioned, there's been a bit of a backlog due to COVID and delay in reporting, and so this is actually from about a year ago. This is current as of a year ago, and I've been. So I don't know what if there's anything additional that has happened, but as of reporting time, this is they were saying that the work group is developing a proposal that would address a few elements. One is that it would be paid on a per member per month basis. That perhaps having a couple of tiers, one pre-tenancy and the other post-tenancy, because there's very different needs and circumstances around those. And acknowledging that some members may need help and support and service on an ongoing basis, while others might graduate. And so there's different kinds of things that contribute to chronic homelessness. And so it goes to stand, as Director Probert was saying, that some things might be curative, if you will, and others might be more like managing the situation. So there have been efforts. Maine Care has some things very much in play to address these. One, in working in partnership with Maine Housing, applied for a CMS Innovation Accelerator Program, or an IAP grant or track. It's a long name. It's a CMS IAP State Medicaid Housing Agency Partnership Implementation Track. This is essentially technical assistance. So there are entities such as the Corporation for Supportive Housing out of Chicago and the Center for Healthcare Strategies out of New Jersey that have expertise in this area. And so CMS, Maine Care is working along with Maine Housing to benefit from those centers of excellence and their expertise. They have monthly meetings, or they started having monthly meetings about a year and a half ago. The work is not yet completed, but they will, as I said, they're drafting a proposal. Will of course seek stakeholder feedback once the proposal is fully developed. Identify what agencies might be interested in providing the benefit, and figure out staffing qualifications and ratios, et cetera. So in summary, to attack the very truculent problem of chronic homelessness, Maine Care is working on it in cooperation with Maine Housing to utilize some nationally recognized centers for excellence to help come up with the best plan for the various causes of chronic homelessness. With that, I will attempt to answer any questions that people have.
Are there any out there? I don't. Representative Perry, are you leaning for the? Yes. Join us when you're unmuted.
Trying to find my hand. Lost it somewhere. Yeah, this is interesting, and I was wondering, was there an intent to do a further report on how they've been able to go forward? Or maybe is that something we need to ask? Because I think this is worth pursuing in terms of more information.
I had the same question. I've asked, and I think that is forthcoming.
Any other questions? Okay, thank you both for doing those reports. We have a number of others lined up that we'll try and catch up with through the rest of the week. Any additional items that we should be considering? I look to the analysts.
I have two questions. The first is whether you do want me to send an email to Molly related to what you just said, which was you were expecting a follow-up from the department. Would you like me to follow up on that request, Representative Zager or anybody? I'm happy to do that.
I don't suppose it would hurt, actually. I mean, I've sent an email request, but they have not really had very much time to respond to that. So, but it doesn't hurt for you to have it on your radar. Thank you very much.
Just trying to figure out if there was an appetite for the committee for that. So it sounds like there might be. And the second thing is I just wanted to return to the issue of the domestic violence amendment and whether you are thinking that we'll do that tomorrow morning after Michelle Probert's presentation.
Sure, we should have time in there.
Okay, so I have reached out to see whether somebody from the domestic violence community that got that contract money would be available, and I'll see what I can do there. And I don't know yet, and obviously the department will be available.
And Anna, what about the Sexual Assault Coalition?
Well, that's who I mean. I'm sorry. I've reached out to them to see if they're available.
Great.
But I only just did that, so I don't know whether they are yet.
Right.
Representative Zager?
Thank you, Mr. Chair. I was able to intermittently follow along some of the discussion when I was not in the Zoom, but I'd like to connect in the proper manner to register my votes once I can make clear what the item is, what the motion is that I'm voting on, because there were some moving parts there. So should that be now, or should I get with Anna after?
The easiest way is probably for me to reach out to, there are 3 of you, and you're not all here right now, by email, and I'll collect your votes and I'll let you know what the votes are so far so that you're not shooting in the dark.
And
So
then
I'll
do
do
they
that
have to
very
be,
shortly.
do they have to be on camera to vote?
Actually, for the budget and the way we've always done it in the past, it's sort of remarkable this time how many 13-0 or 8-5, whatever. The point is everybody present votes that we have compared to normal. But in the past, we've just reached out to whoever wasn't available or wasn't present, and they just told us how they wanted to vote. It's different from how the LDs work, where they have to go through more official channels.
Just want to make sure everybody got a chance to get their vote recorded the way they wanted it.
Yeah,
Okay,
we've been following up actually.
good.
Thank you.
Any other points? Any other questions or concerns? Any other items of business before we take a break until tomorrow? And as I look at the calendar, we'll be convening again at 10 as a committee,
9.
9 as a
And
committee.
that's right. And I just want to remind you that tomorrow you'll be expecting AFA to call into your meeting
Okay.
Okay.
between 9 and 10:30 for the presentation from
Yep.
the main care director.
Right. Very good. Tomorrow I'll need to step away to do a work session later in the morning, but we'll certainly start and hear what Ms. Probert has to say about how we're doing with the rate studies. That'll be interesting. All right. In the absence of any other business, I'll entertain a motion to adjourn.
Motion to adjourn.
Second.
All those in favor, we don't need to involve Ms. Withy in that one. Very good. I did include the link. It looks much better, and it's all literally on one page. So that should be coming to you as soon as she gets a chance to get to her email. All right. Thank you all. And